which is a type of bacteria. And this can cause Lyme disease. In the United States, the Ixodes tick can also transmit human granulocytic anaplasmosis and babiosis. Ticks have 3 stages in their life cycle: larva, nymph, and adult. Lyme disease is most commonly transmitted by the nymphal ticks, which are typically most active in the late spring and early summer. But adult ticks can also transmit Lyme disease, but this is less common because adult ticks are large and they're easily seen, so they're more likely to be removed. When you find a tick on yourself or your child, the questions that should be asked are, was the tick a member of the Ixodes species? Was the tick a larval, nymphal, or adult tick? Was the tick attached? How long was the tick attached? Was the tick engorged? Feeding ticks are firmly attached to the skin and are the only ones that are capable of transmitting Lyme disease. Those that are engorged are most likely to have spread their germs to you. So what happens is, as the tick feeds, it releases its saliva into the bite, into the wound, and the spirochete gets into our bodies. Prompt removal is the first step to prevent transmission of Lyme disease. Removal should minimize retention of residual tick parts. The proper technique to remove a tick is to use fine-tipped tweezers to grasp the tick as close to the skin surface as possible. The tweezers should grasp the head of the tick and avoid compressing the tick's body. Then you pull straight up, gently but firmly, using steady pressure. Do not squeeze, crush, or puncture the body of the tick because its inside fluids may contain the infectious agents. After tick removal, the bitten person or the parent should observe the bite site. They should observe the bite site for the development of erythema migrans for 30 days. Techniques that we should not do include the application of petroleum jelly, fingernail polish, isopropyl alcohol, or a hot match. Unlike the use of tweezers, these techniques have been found to increase the likelihood of tick mouthparts being left in the host skin. Now, the approach to prophylaxis. The indication for prophylaxis, which means the reasons you should be given doxycycline after you've had this experience with a tick, include the attached tick is identified as an adult or nymphal Ixodes tick. The tick is estimated to have been on the skin for over 36 hours based on the degree of engorgement or time of exposure. And prophylaxis begins within 72 hours of tick removal. Also, if you live in a highly endemic area, prophylaxis should be considered. So for patients who meet criteria for prophylaxis, the recommended dose of doxycycline is 200 milligrams for adults and 4.4 milligrams per kilogram to a maximum of 200 milligrams per dose in children, given as a single dose, no matter their age, to reduce the risk of acquiring Lyme disease after the bite of an infected tick.